Now, today, the House of Representatives is expected to vote on the $2.2 trillion stimulus plan.
And that tops our list of the top 3 things that you need to know today. Once it's approved, President Trump says he will sign the bill immediately. It would provide $1,200 for most adults and $500 per child. Most of us are wondering when we can expect to see those checks. The general consensus is that it could take another 2 to 3 weeks. House Speaker Nancy Pelosi says other issues like expended SNAP benefits and family leave may be revisited later, but this is a first step towards trying to help workers who need it the most.
So for workers and for families, with all 3 of our bills, we have put families and workers first.
Now, today, North Carolina Governor Roy Cooper will join members of his coronavirus task force to update us on the outbreak. Now, this comes amid growing calls for a statewide shutdown. The News and Reporter reports the president and CEO of WakeMed is joining the North Carolina Healthcare Association in calling for the order to help control the spread of the virus.
And starting tonight at 5 o'clock, Gadsden County will join Mecklenburg and Cabarrus counties in issuing a stay-at-home order. It will remain in place for 3 weeks. Gadsden County has 11 confirmed cases. The head of Gadsden County Health and Human Services said if the county continues at this rate, they expect 40% of half of more than the 400 people tested will have the virus by May. Well, it has now been nearly 24 hours since Mecklenburg County's stay-at-home order went into effect, and that means there are a lot of empty streets around Charlotte.
That's right, but there are also a lot of essential workers still on the job. Eyewitness News reporter Gina Esposito is in Cotswold in front of a Harris Teeter with a look at what kind of difference a day has made.
Yeah, about 24 hours ago, we started to see a lot of those employees with Harris Teeter here in Cotswold start to show up for work, and we're starting to see that now. As you can see, that worker heading to the store, some cars in the parking lot. The store here opens up in just about 2 hours later today because it's not an early shopping day for seniors, but grocery stores are one of the businesses that will remain open under the order. Now, this is what the store looked like just before 6 a.m. yesterday. People were practicing social distancing while waiting for the store to open. They were trying to make that last-minute trip before the stay-at-home order went into effect. Hours into that order, we wanted to see what life was like on the streets of Charlotte. We stopped by this car repair shop. It was open because it's considered an essential business. But down the street in Noda, things were quiet. Most of the shops were closed. Restaurants, however, like Cabo Fish Taco, remained open, busy with delivery and takeout orders. Only a few people were walking the streets.
We're doing kind of the same thing that we've been doing, ordering groceries on delivery when we can find it and trying to stay inside but also active as much as possible.
And again, while many people are staying home, we still saw construction workers out in Charlotte, mail carriers and other essential jobs. And of course, you can still get outside and enjoy the parks and greenways. Just remember to keep a distance. Back to you.
All right. Thank you, Gina. Now, this morning, the Freightliner plant Gaston County is on shutdown after a union representative told us a worker there tested positive for coronavirus.
Over the phone, he told Gadsden County Bureau reporter Ken Lemon that worker is in the hospital on a respirator. Here's a portion of that phone call he had with Ken.
Right now, its number one priority is keeping those that aren't sick safe. And how do we progress from there? So right now, we're on a 2-day shutdown. We're not scheduled to go back to work till Sunday night, maybe Monday morning, and that's still pending, depending on, what the shop chair and the plant manager discuss on how they want to handle this. The plant is going to be going through a deep cleaning for the next 4 days.
And that union representative said if there's a second case of the virus, they're going to ask for a full work stoppage. He told Ken 3 people went home sick, but at this point, only 1 person has tested positive for the virus. Well, the virus has really taken a toll on people's jobs.
Well, we first told you yesterday nearly 3.3 million people filed for unemployment last week. For a little perspective, that's more than enough people to fill up every NFL stadium in the United States. It more than quadruples the previous record of 695,000 set back in 1982. So we took a deeper dive into those numbers to see the impact on the Carolinas. More than 110,000 of those unemployment claims were filed here in North Carolina. 30,000 more are from South Carolina. One woman told us she couldn't even get through to North Carolina's employment office to try and even get the benefits. Allison Mayall and Nicholas Webb live in the Asheville area. Nicholas had trouble trying to apply online, and then he was denied because his application was connected to another employer. The fear of mounting bills, the frustration of the process is getting to them.
Halfway through the application process, we were kicked off. The entire site went down.
I've called relentlessly for 3 days with no contact from anybody whatsoever.
So frustrating. So we asked employment attorneys what you need to know if you're in this situation. First, just understand the system just wasn't built for this kind of volume, so going online is still the best way to go. And second, have the details on your employment for the last 2 years ready to go. Now, social distancing in some job is easier said than done, but some who work in large plants or at a fast food drive-through are working close together and worrying about getting sick. Now, neither North or South Carolina has issued a statewide shelter-in-place order. So for now, it's largely up to each employer to decide how they'll respond to the virus.
With the pandemic, there's potentially a direct threat to health and safety. And I would just encourage people to protect their neighbors and do the right thing.
DHEC says if there is a confirmed case of coronavirus in the workplace, employers should let workers know, but maintain the confidentiality of the employee. They also need to immediately try to identify others who might have been exposed and alert them.
Right now, there are plenty of Americans stuck abroad looking for help to get back home. We first told you about a Charlotte native, Matt King, who's in a hostel in Peru. Channel 9 spoke with him yesterday. He is now confined to his room after the government found 2 people in the hostel with COVID-19. King says there are more than 100 people, including 14 Americans, at that hostel, and nearly half of them are showing symptoms. He says he wants to come back home, but everyone is now in quarantine, possibly for months.
They said the quarantine still lasts anywhere from 1 to 3 months. We need to spend 23 hours a day in our room, with 1 hour being outside. And all of the meals are now provided by the government.
Definitely a tough situation there. King says he continues to reach out to the American Embassy in Peru, but they are overwhelmed. He hopes North Carolina Senator Thom Tillis can help, but so far he hasn't had any luck. Well, you may have seen warnings telling you not to take ibuprofen if you think you have the coronavirus.
So we wanted to know if there's any truth to those warnings. So reporter Blair Miller got an update from the FDA.
A French health official recently tweeted a warning for coronavirus patients, causing concern around the world. The official said doctors should not order anti-inflammatory drugs such as ibuprofen for people who have the infection. Ibuprofen is given to reduce pain, fever, and inflammation. It's in a class of drugs called non-steroidal anti-inflammatory drugs and sold over the counter as brand names you may recognize, Advil and Motrin. After the French official's warning, the Food and Drug Administration issued a statement saying it is, quote, not aware of scientific evidence that suggests ibuprofen worsens COVID-19 symptoms. The World Health Organization and United Kingdom's National Health Service also now say they do not recommend against taking ibuprofen. The bottom line here, if you're feeling symptoms of the coronavirus, check with your doctor for the best treatment plan for you. I'm Blair Miller reporting.
And another issue right now, many of us are dealing with seasonal allergies, but allergies and coronavirus have some symptoms in common. So how can you tell the difference? Well, a doctor with Novant Health told us a fever is the #1 distinguisher between the coronavirus and seasonal allergies. Another way to tell if it's allergies or a virus is fatigue and body aches. So if you're feeling tired or sore, those are symptoms associated with COVID-19 and the flu. Allergies can sometimes cause fatigue, but it's more prolonged.
Itching, sneezing, itchy eyes, watery eyes, runny nose, these are not features of coronavirus in specific. So with COVID-19, you don't get the runny nose. And usually the runny nose with allergies is clear.
Well, shortness of breath is also a symptom of coronavirus. It's not usually associated with seasonal allergies unless you are someone who has asthma that can flare up because of allergies.